Good afternoon, everyone. This is Christine at Health Current, and thank you so much for joining us for today's webinar, Patient Electronic Access. This presentation is provided through a shared commitment between Access, ADHS, Health Current, and Myers and Stofers to increase participation in the Medicaid Promoting Interoperability PI program. Just a few logistical reminders today that we'll be recording the webinar and it will be posted to the Health Current and Access websites. We encourage you to use the chat box for questions or comments. Just a reminder to please include your name, your practice, but no patient health information or PHI. We will be starting in just a few minutes, and we are going to be using Poll Everywhere today throughout the live presentation. Many of you have already engaged in the question, what is your favorite fruit? So thank you for those who have already engaged their mobile device or PC. For those of you who are just joining us, we are going to again be using Poll Everywhere, so you can participate in live polling and actually see the results. If you have not had a chance to engage your mobile device or your computer, the instructions are here on the screen. Open up a new browser, go to pollev.com, enter the word EO program 753, or if you're on your mobile device, you can text the word EO program 753 to the number 22333. EO program 753 is not case sensitive. And you will also see those instructions on the very top of each of the polling screens. So if you get stuck anywhere, they will be right at the top here. I'm so sorry. So here you have some folks have already responded, and you can see right at the top, if you're using your web browser, pollev.com/EO program 753, or your mobile device, EO program 753 to the number 22333. And then you can actually text the word or type the word, and it'll actually pop up in this fun word cloud. With that, I think we've got some really good responses. These look like really great, yummy fruits to have right at the lunch hour. Connie, are you on with us?
I am. Can you hear me?
I can, Connie.
All right. Thank you so much. I have the great honor today of introducing our presenter. She is Priscilla Clark, as Senior Accountant of Myers & Stoffer, a certified public accounting firm specializing in federal and state Medicare and Medicaid programs, is our webinar presenter today. So Priscilla, you may begin your presentation. I believe Christine is advancing the slides for you, and everyone enjoy the polling process as well. Thank you.
Thank you so much, Connie and Christine. Thank you everyone for joining this webinar. Today we will be discussing the patient electronic access objective for meaningful use. Next slide, please. So there are three learning objectives that we want you to walk away from this webinar learning. First is to know the patient electronic access requirements for the Medicaid Promoting Interoperability, otherwise known as the PI program. The second learning objective is to understand the differences in Objective 5 patient electronic access between program year 2019 and program year 2020. And the third learning objective is to learn about Arizona's patient electronic access documentation requirements. Next slide. So here's going to be our first polling question, and we're just trying to gauge and find out what each of the participants on this presentation understand and where they're at. So has your practice implemented the 2015 Addition Cert Systems requirement for stage 3? As you can see at the very top, you can go using your web browser by going to pollev.com and then respond with EO program 753, or you can use your cell phone and text EO program 753 to the number 22333. And then you'll just text A, B, C, or D. A for yes, B for no, C for unsure, and D for not applicable. I see that we're receiving quite a few responses. I'll give you about 5 more seconds to send in your answer, and then I'll start to discuss the correct answer and what your practice should be doing. Just make sure to go ahead and just provide your response, A, B, C, or D, depending on what your practice or the provider that you're representing today has done at their practice with their CERT system. It looks like a majority of you are saying yes, that y'all did implement the 2015 edition CERT system requirements for stage 3. If you are unsure or if you do not know what is going on with that, whether the practice has the 2015 edition CERT or whether that provider that works at that practice location has the CERT implemented for stage 3, you want to make sure it's a 2015 edition CERT. So if you do not know that, or you know the answer is no, you need to reach out to your vendor as soon as possible and just reach out to them and ask them when that's going to be implemented, because to meet the stage 3 requirements, starting program year 2019, program year 2020, and program year 2021, it is a requirement that the practice have the 2015 version CERT. Okay, next slide. So the objective 5 of the program is patient electronic access. The EP provides patients or patient authorized representative with timely electronic access to their health information and patient-specific education. This objective has 2 measures. An EP must satisfy both measures for this objective through a combination of meeting the thresholds and exclusions for each measure. Next slide. We're going to go over some definitions just to help you understand this objective and just some of the terminology we will be using throughout this webinar. Provide access means that when a patient possesses all of the necessary information needed to view, download, or transmit their information. This could include providing patients with instructions on how to access their health information, the website address they must visit for online access, a unique and registered username or password, instructions on how to create a login, or any other instructions, tools, or materials that patients need in order to view, download, or transmit their information. Next slide. Another definition is for view. So what does that exactly mean? So it's when the patient is accessing their health information online. Download is the movement of information from online to physical electronic media. Transmission, this may be any means of electronic transmission according to any transport standards, and there's a couple listed there. However, the relocation of physical electronic media, such as a USB drive or a CD, does not qualify as transmission. Business days are defined as Monday through Friday, excluding federal or state holidays, on which the EP or the respective administrative staff are unavailable. Diagnostic test results, all data needed to diagnose and treat disease. Examples include, but are not limited to, blood tests, microbiology, urine analysis, pathology tests, radiology, cardiac imaging, nuclear medicine tests, and pulmonary function tests. Next slide. Here's another polling question. So is the AP function enabled at your CERT? And that's the application programming interface. So do you know if that is enabled currently at your CERT for program year? And we'll give you a few minutes to send in your responses. As Christine explained at the beginning, at the top of that slide does show how to access to be able to submit your response. So you can use your web page, or you can use your cell phone and text your answer in. We'll give you about 10 more seconds to send your responses in. Again, is the API function enabled in your CERT? Okay, I see we have a variety of answers. So if you said yes, that's great. One of the requirements of the API, this objective, is that the application programming interface needs to be enabled at your CERT. So if you did say no, you want to reach out to your CERT and ask them what is going on, why it's not enabled, because if that API function is not enabled in that CERT, in your CERT at the practice, then there is some concerns, and if it's not enabled, you won't meet the requirements of the program. So if there's any, if you're unsure or it's a no, if your response is a no, then definitely reach out to your CERT, ask them what's going on, and if you have additional questions or you're not sure what to do, feel free to reach out to Access or Health Current. At the end of this presentation, We will give you the contact information for reaching out and asking any questions, and we'll also be answering any questions you have at the end of this presentation. But again, if you did say no or unsure, make sure you reach out to your vendor and ask them what is going on and why it's not enabled. Next slide. So we're going to be covering first Objective 5, Measure 1. So Measure 1, for more than 80% of all unique patients seen by the EP, the patient is provided timely access to view online, download, and transmit his or her health information. And the provider ensures the patient's health information is available for the patient to access using any application of their choice that is configured to meet the technical specifications of the application programming interface, referred to as API, and the provider's CERT. Next slide. So what is an application programming interface, that API? It is a set of programming protocols established for multiple purposes. APIs may be enabled by a provider or provider organization to provide patients with access to their health information through a third-party application with more flexibility than is often found in many current patient portals. Next slide. So what is the difference between an API and an app? An application, which we'll be calling an app, is a software program designed for individuals to use on a mobile device. Apps are usually downloaded by a user to their smartphone or tablet. An API is a set of routine protocols and tools that governs how applications interact with other software programs or applications. For example, patient portals are often interfaced to the CERT via an API. An API connects the data from the app and the CERT. Next slide. So API analogy. So we're going to look at this as an ATM. So a lot of you, if you do not know what an API is, hopefully this example will kind of help you understand it a lot more. So as you can see on that left-hand side, the data that's in an ATM. So someone's going to the ATM and they're the customer and they're going to use the ATM to pull money out of their account. So how this all works is we're going to refer to this ATM machine as an app, and then the user is going to be the customer who uses that ATM. And then we're going to discuss that technology of the data and then how API interacts with that. So in the back end is going to be the CERT, or otherwise known as the bank in this example. And so the bank knows what's going on with your bank account. Now, how does that ATM machine get all that information? Well, the ATM machines, the technology will come from the bank, sending it to that ATM machine, saying how much cash you have in your account. So there's all these kind of wires going back and forth and sending information to communicate back and forth with the bank and the ATM machine. So the API is the technology that sends your request for cash to the bank's database, verifies that there are enough funds in your bank account to withdraw, provides the permission from the bank to the ATM, and then communicates back to the bank how much you withdrew. So taking this ATM machine, I'm going to put it into the perspective of in the healthcare industry. So when it comes to this API, so you download an app to your cell phone, and then the patient, which is the user, logs into their information on that app, and that app should be using the API, which takes information from the CERT, from the practice of CERT. The doctor entered in all that patient information from their visit. It's in the CERT. But for it to get from the CERT to the app so that the patient can access that information, that technology that's transferring that data is the API. And so this requirement is that you are offering that to your patients so your patients can access their health information. Next slide. So what are the API requirements for this measure? An EP needs to fully enable the API functionality of the CERT so that any application chosen by a patient will allow the patient to gain access to his or her individual health information, provided that the application is configured to meet the technical specifications of the API. And in that previous polling question, if you responded no or unsure, you want to make sure that API functionality is enabled because it is a requirement. So reach out to your vendor and confirm that. EPs may not prohibit patients from using any application, including third-party applications, which meet the technical specifications of the API, including the security requirements of the API. EPs are expected to provide patients with detailed instructions on how to authenticate their access through the API and provide the patient with supplemental information on available applications that leverage the API. CMS does not specify the method EPs must use to provide this information. However, the EPs need to be able to document how the information was communicated to that patient. So make sure you know what the practice or the EP is doing to provide instructions to the patients on how to use the API, and then what information is available on the applications that connects that API, connect the app to the cert. Next slide. So here is another polling question. What type of access must an EP provide to a patient to access their health information? So does the EP just need to say that the patient is viewing their information? Does the patient just need to be able to download their information? Does they just need to be able to transmit it? Or do they just need to make sure that patient can use the API? In other words, downloading that app and accessing the information via the technology of an API. Or you can select all of the above. So please put in whatever answer that you think is correct based on what we've discussed and what you know from the program. We'll give you a few seconds to put in your responses. As previously stated, at the very top explains how you can go in and vote and submit your response. Okay, it looks like everyone knows the answer to this. It is all of the above. It is E. So the reason for that is that the measure is saying the patient has to be able to view it. They have to be able to download the information. They have to be able to transmit, and they have to be able to use that API to get their information. It does not mean the patient for this measure does not have to use those things. The provider just has to provide access via all four of those avenues. Next slide. So CMS requires EPs to first enable their API before or during the EP promoting interoperability reporting period. During the period is allowed only if the EPs could still exceed the 80% threshold. So if you enable your API during that meaningful use reporting period, those patients that you saw prior to enabling the API never had access to their information via the API within 48 hours after their visit, which takes us to that second requirement. The EP needs to provide patients access to their health information via an API within 48 hours of the information being available to the EP each and every time that information is generated. So if you have enough patients once you enable the API, then you have enough patients and they have access to the API to meet that 80% threshold, that's fine. We do recommend that you make sure the API is enabled beforehand, just in case, because we want as many EPs to be able to meet the requirements of the program. Next slide. Similar to how EPs support patient access to view, download, and transmit capabilities, EPs should continue to have identity verification processes to ensure that a patient using an application, which is leveraging the API, is provided access to their health information. EPs must offer all four functionalities to their patients, and patient health information needs to be made available to each patient for view, download, and transmit, including via API within 48 hours of the information being available to the EP for each and every time that information is generated, regardless of how long the patient has been enrolled. Next slide. Here is another polling question. If a patient has multiple encounters, how often does the EP have to provide access to the patient's information? Is it just once? Is it never? Is it every time? Or are you unsure? So please submit your response via the web or your cell phone for what you think is the best response. We'll give you a few seconds to submit your answers. So for example, if the patient came in 3 times during the period, do they just need access to their information from their first visit, just from their second visit, just from their third visit, not at all, or for all 3 visits? A few more seconds, make sure to get your answers in. It looks like you all know what you're doing. It is every time. So every time that patient comes in, they need to be able to access their information. So for example, the patient comes in 3 different times, they should be able to go to that app, which is using that API, and be able to access their information if they want to for all 3 visits. They should see, hey, I came in May, this is what happened, this is what test results were done, I came in June twice, and here are those test results. So you're showing all those test results when the patient goes in and logs in. Next slide. In circumstances where there is no information available to populate 1 or more fields, either because the EP can be excluded from recording such information or because there's no information to record, the EP may have an indication that the information is not available and still meet the objective and its associated measures. The patient must be able to access this information on demand, such as through a patient portal, a personal health record, or by other online electronic means. We note that while a cover entity may be able to fully satisfy a patient's request for information through the view, download, and transmit, the measure does not replace the covered entity's responsibility to meet the broader requirements under the Health Insurance Portability and Accountability Act, otherwise known as HIPAA, to provide an individual upon request with access to patient health information in a designated record set. Next slide. Here's another polling question. Is an EP allowed to enable their API during the EP's promoting interoperability reporting period? Yes is A, no is B, and for C is unsure. So if you're using your cell phone, text A or B or C to provide the answer. I'll give you a few seconds to submit your responses. Again, at the top of the slide, you can open up your web and go to that website listed, or you can use your cell phone and text the number 22333. A few more seconds for y'all to enter in those last few responses. Okay, looks like everyone's choosing A. You are correct. So the caveat here is, though, as we previously discussed, during the period is allowed only if the EP could still exceed that 80% threshold. So if the patient saw 50% of their patients during that 90-day period, okay, so they have a in-year reporting period of October through December. End of November, the practice decides to implement, turn on the API, enable it. Well, if they already saw over 20% of their patients, so they said, let's say they saw 30% of their patients already, and then in December, they saw the remaining 70%. That 70% had access to their API within 48 hours, but those first 30% of the patients did not have access to their information via the API within 48 hours of their visit, and therefore the EP is not able to meet the requirements. So although this is loud, because for another example, if that EP enabled the API the end of October, and they'd only seen 10% of their patients, and then the remaining 90% of their patients during that in-year reporting period were seen in November and December, well, those patients would have been able to access their patient health information via that API. And so the EP would be at 90%. And remember, that threshold is 80%. Okay, so in that second scenario, the EP would meet the requirements. So just keep that in mind, that even though the EP can enable the API during the PR reporting period, it's best to just make sure it's enabled ahead of time. If you have questions about that, feel free to reach out to Access or Health Current. I can even answer some questions at the end of this presentation about that. We want to make sure you meet the requirements of the program and that you're prepared ahead of time. Next slide. While meaningful use is limited to the capabilities of CERT to provide online access, there may be patients who cannot access their EHRs electronically because of a disability. EPs who are covered by civil rights laws must provide individuals with disabilities equal access to information and appropriate auxiliary aids and services as provided in the applicable statutes and regulations. A patient who has multiple encounters during the PI reporting period, or even in a subsequent PI reporting period in future years, needs to be provided access for each encounter where they are seen by the EP. EPs are allowed to include patients in the numerator who opted out of the patient portal. Details regarding opt-out patients are included later in the presentation. Next slide. So what changed between program year 2019 and program year 2020? Just the API. So view, download, and transmit has been a requirement and has remained the same for 2019 and 2020. However, starting in 2019, the API can be enabled before, during, or after the PI reporting period, so long as it was enabled by December 31st, 2019. And that is only applicable to program year 2019. However, in 2020, the API must be enabled within 48 hours of the information being available to the EP for each patient. So that timely access to their health information via the API is an option for the patient. So in 2019, it didn't have that information via the API did not have to be provided to the patient within 48 hours as long as it was provided within that calendar year. But in 2020, CMS did enforce stricter requirements, and so that API must be enabled within 48 hours. Access does recommend that the EP enable the API prior to the start of the PI reporting period, and that the EP ensures the connection remains uninterrupted throughout the PI reporting period. Next slide. So what are the documentation requirements for Measure 1? First off, you need to submit a CERT-generated dashboard for the selected PI reporting period that shows the following 4 things: the provider's name, the numerator, the denominator, and the measure percentage. So when you go up to submit that CERT-generated dashboard during prepayment, just make sure it has those 4 things listed. A few things to keep in mind about that CERT-generated dashboard is that in certain situations, a non-CERT-generated report may be necessary. The use of non-CERT-generated reports may be permitted upon access review and approval. So just make sure if you're questioning a report because it doesn't show it was pulled from the CERT, then feel free to reach out to Access or Health Current if you have any concerns about that. Also, for that numerator, if the EP used opt-out patients to meet the measure threshold, additional supporting documentation is required. So if you're going to add some numbers, some patients to that numerator that is showing in the CERT dashboard, we may request additional documentation. And again, we're going to discuss opt-out patients a little later in this presentation. The second item that must be submitted by the provider is a copy of instructions provided to patients on how to authenticate their access through the API. Examples are included on the following slides. The third item is a copy of information given to patients on available applications that leverage the API. Examples we'll show you in a few slides. Next slide. So here is an example of the instructions provided to patients on how to authenticate their access through the API. So this is handed to the patient. The practice gives it to the patient after the visit, or it could be prior, right before they go in to see the doctor, and it basically explains how to access that patient health information. And for this example, it's through MyChart, and it just gives like some details. Here's a link for it, things like that. The practice confirms that the information above is emailed to every patient immediately after the visit. MyChart is connected to the practice CERT via an API. So when we were first provided this document, we had to reach out to the practice and say, okay, did you provide this to every patient? Because if you only provided it to some patients, then those patients that did not receive these instructions should not be included in that numerator. So when you implement procedures for when patients are coming in, just make sure you're applying that to all the patients. So this practice didn't meet the requirements because they provided these instructions on how to authenticate access to the API to every patient that was seen during the annual reporting period. Next slide. Here is another example, which is a copy of instructions given to patients on available applications that leverage the API. So it shows that this is going to same practice. We had to request both of these documents and that CERT-generated dashboard. And this screenshot, this example is showing that they're saying, hey, after you create your account and activate MyChart, you can download the mobile app. So it's referring to an app to access that patient health information. So you need to not just provide instructions on, hey, how to access the information through the API. You need to say, hey, here's a potential app that you can use. So just make sure you're giving both of those types of instructions to the patients. This was included in the email sent to the patients on the previous slide. So we had to confirm that both of these examples were sent to every single patient after the visit. Next slide. Here's another example of available applications. This is a flyer that was distributed to patients via email, And it was basically telling them what potential app they could use to connect with the practice's patient portal. As you can see at the very end, it says, for assistance in accessing your information using an application other than Apple Health, please call. And that was instructing them to a certain cert vendor in case they wanted to use a different application. So there can be a variety of these instructions. They can differ, but just make sure those instructions meet the instructions or meet the requirements on how to authenticate their access to the API, and then also provide them at least one available application that leverages the API. And you provide those to all your patients seen during and in your reporting period. Next slide. So we will be discussing Objective 5, Measure 2, which is the EP must use clinically relevant information from CERT to identify patient-specific educational resources and provide electronic access to those materials to more than 35% of unique patients seen by the EP during the PI reporting period. Next slide. Paper-based actions are not allowed to be counted. EPs may provide paper-based educational materials, but they may not be included in measure calculations. Actions included in the numerator must occur within the calendar year in which the PI reporting period occurs. Next slide. So what changed between program year 2019 and program year 2020? Nothing changed. So it's the same requirements that you had to meet in program year 2019 if you attested that you now have to meet in program year 2020. Next slide. So what are the documentation requirements for Measure 2? You need to submit a CERT-generated dashboard for the selected PI reporting period that shows the following: the provider's name, the numerator, the denominator, and the measure percentage. Those 4 items. Keep in mind, this is exactly the same as what would have been submitted for Measure 1. It's just showing the Measure 2 numerator and denominator and measure percentage. Keep in mind that in certain situations, a non-CERT-generated report may be necessary. The use of non-CERT-generated reports may be permitted upon access review and approval. If the EP used opt-out patients to meet the measure thresholds, so added those to that numerator, additional supporting documentation is required. We'll discuss opt-out patients in a few slides. Please ensure that this numerator, denominator, measure percentage shown on that CERT-generated dashboard is specific to that individual provider. It shouldn't be, that numerator and denominator should not reflect the practice overall numbers. It should just reflect that specific provider you're attesting for. Next slide. So Objective 5, opt-out patients. CMS allows EPs to include a patient in the numerator of Objective 5, Measure 1, and Measure 2 if the patient elects to opt out of electronically accessing their health information. The patient must still be included in the denominator. An EP may count that patient in the numerator if the patient has provided all the necessary information to subsequently access their information, obtain access to a patient authorized representative, or otherwise opt back in without further follow-up action required by the EP. Next slide. So opt-out patient documentation. You want to create an opt-out patient audit log, including the patient name or identifier and the date of service. Do not include patients in the opt-out patient audit log that are already included in the numerator of the CERT dashboard, because that numerator and the CERT dashboard are the patients that were provided access to view, download, transmit, or via API. For this, specific, for these opt-out patients, they're saying, hey, we don't even want an account set up for us. And then that patient never went into the numerator. That patient did go into the denominator, however. So when you create that opt-out patient audit log, you want to make sure you do not include patients that are already included in the numerator. And if you have concerns about which patients are included in the numerator, you should reach out to your vendor to see what their, how their coding works in the software. For Measure 1, the EP must provide API documentation to all patients who opt out of seeing their patient health information. If the API documentation is provided via patient portal, the EP must separately provide it to all opt-out patients via another means, because patients will not be able to view the documentation in the portal. So for example, if a patient comes in, they're seen by the doctor, they're like, we don't want to access the patient portal, I don't want any access to my information, I don't care for it, then, and if your protocol is to send those copy of instructions about API via the patient portal, once the patient signs into the patient portal, then you know this patient is never going to see those instructions. So you need to make sure you print those instructions out and give them to that patient, because to be included as an opt-out patient audit log, the patient had to find out And like I said, I don't want to view, download, transmit, or have access via API. You need to retain documentation supporting the opt-out patient audit log. The documentation must demonstrate the patient willingly chose to opt out. And we have a few examples of that. First example is that the patient signed a document stating the patient is opting out. The second example is the patient provided all the necessary information but did not log into that patient portal. So you set it up, that information is sitting in that patient portal, but the patient never logged in, so they never were potentially included in the numerator. In this example, you want to make sure your vendor, if you're confused on whether that patient is added to the numerator already based on your vendor's software, you might want to reach out to them and just confirm that to make sure you're not double counting a patient in the numerator. Next slide. Here's an example of an opt-out patient audit log. As you can see, I'm starting on the left-hand side of the screenshot. You can see the patient ID, the patient date of birth, the provider, the service date, and then you can see health information made available timely. So was that information provided to them within 48 hours? And that next line is saying, did the patient opt out of participation? So if they opted out of participation, you're good to go. These are all just examples that were made up, and none of this is actual patient health information. We just made up some random dates of birth and service dates for these patients. The opt-out patient audit log must include only patients at a visit during that PI reporting period. So don't go including patients that are outside the PI reporting period. Additional documentation to validate the accuracy of the audit log may be requested if selected for post-payment audit. For example, a copy of the document the patient signed stating he or she opts out. So if you provide that audit log and during prepayment access may reach out to you and say, can you provide me the signed copies from patients 114 and 116. Just keep that in mind, make sure you're keeping all your documents. Next slide. So when entering data into ePIP, when you're including opt-out patients, you have to do some calculations on there. So you want to calculate the numerator as follows and enter that into ePIP for the numerator. You take the CERT dashboard numerator plus the entries in the opt-out patient audit log. This is only applicable, but it's not only if applicable, use this formula. It's not required. So if your CERT dashboard numerator is sufficient and gets you to the threshold, then you're good to go. You don't need to go create an opt-out patient audit log to add those additional patients into the numerator. EP should ensure patients included in the opt-out patient audit log are not also included in the CERT dashboard numerator. So for example, say your CERT dashboard numerator shows 50 patients and you're not meeting that minimum threshold, then you want to go and look at potentially which opt-out patients you can add, and you want to create that audit log with that information and then add those patients. So say there's 10 opt-out patients and then you had 50 patients in that CERT dashboard numerator, your total numerator entered into ePIP should be 60 patients that had access. Next slide. So let's discuss the exclusions for Objective 5. So an EP is not required to submit data or meet the measure because the EP can submit documentation instead for how he or she met the exclusion. The exclusions for Objective 5, patient electronic access, is no office visits criteria and then the broadband criteria. Next slide. So for measures 1 and 2, an EP may take an exclusion for either measure or both if either of the following apply. The first one is the EP has no office visits during that PI reporting period. The second is if the EP conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabytes per second broadband availability, according to the latest information available from the Federal Communications Commission on the first day of the PI reporting period. Exclusions for this objective are the same as the exclusions imposed in year 2019. Next slide. So the broadband access exclusion, there's some additional information on the slide talking about how CMS identified certain counties in the U.S. who met that broadband exclusion. And the link at the very bottom of this webinar that you can look at later on after this presentation if you want to, list those counties. And Arizona, the state of Arizona does not have any counties listed. Therefore, an EP in Arizona is not able to meet this exclusion. So keep that in mind as you're at testing. If you're trying to take an exclusion, you're not going to be able to meet this exclusion because although those counties or this tip sheet with the link at the bottom is referencing 2015 to 2017, CMS has not published an updated list of the counties. However, a majority of the counties in the U.S. have increased their broadband availability, and still do not meet the requirements of the exclusion. So as technology starts to increase, you know these counties are increasing their broadband width, and so therefore they're not going to go below 4 megabytes per second, and therefore a county meeting that exclusion is not going to be meeting the exclusion 5 years later. So keep that in mind. Next slide. Here's another polling question. Which of the following documents must an EP submit during attestation for Objective 5? Select all that apply. So the first one for A is information given to patients on applications that use the API. B is the opt-out patient log, if applicable. C is instructions provided to patients on how to authenticate accessing via the API. And D is the cert-generated dashboard for the PI reporting period. Keep in mind, for this one polling question, you can select multiple items. So you can select and submit your response for A, B, C, and D if you choose, or just A and B, or just A, C, and D, depending on what you think is the correct answer. So go ahead and submit those responses. We're going to give you a little bit extra time on this question because there is so much information on there and multiple different options that you can come up with. So go ahead and vote on what you think is the best response. I'll give you about 15 seconds to go ahead and submit your response. So whether you're submitting it via text or via the web link, you can select multiple options or send them the text for multiple A, B, and C, C, and D, whatever you think is the best option. Give you a few more minutes to go ahead and get those answers in. A few more seconds. My apologies. Okay, so it looks like the response here, so there's 3 that have to be submitted for Objective 5, Measure 1, because we've discussed Measure 1 and Measure 2. So let's take your Measure 2 real quick. The only document needs to be submitted for Objective 5, Measure 2 is D, which is the cert-generated dashboard for the PI reporting period. For Measure 1, there are 3 mandatory minimum requirements for the documents that must be submitted, and that's A, C, and D. So you have to give a copy of instructions provided to the patients on how to authenticate their access through the API. That's A. That has to be submitted by each EP that is attesting. For C is also correct. It needs to be a copy of information given to patients on available applications that leverage the API. So that's the second document that must be submitted to meet the requirements of the program for program year 2020. And then D is also correct. Cert-generated dashboard for the PI reporting period. So that should have been, everyone should have selected that one because that is a requirement for both measures. The only one that was an option, which means you could have selected it and still been correct, was the opt-out patient log if applicable. So you only need to include an opt-out patient log if your cert dashboard is not showing you those minimum requirements and you had some opt-out patients during that PI reporting period. So again, that opt-out patient log for B is only required if you're adding opt-out patients to your numerator. Then you need to submit that. And potentially as Access is reviewing the attestations of the documents submitted, they may reach out to you regarding additional questions or additional information related to that opt-out patient log. Next slide. So what exclusion documentation is required? The EP has no office visits during the PI reporting period, so that first exclusion. The EP, if they're a testing staff, must submit documentation supporting that all patients seen by the EP are conducted outside the office. And that type of documentation varies a lot from practice to practice. We could be looking at your cert report or different other documentation showing that all your patients are seen outside the office by that specific provider at testing. The second exclusion is that broadband access exclusion, which we already discussed, is not applicable for Arizona EPs, and they're unable to meet the exclusion per CMS. And there's the link for that tip sheet, just listing the counties that meet the requirements for that exclusion, and there are no Arizona counties that meet the requirements for that exclusion. Next slide. Here's another polling question. Would you like to be contacted for further assistance? You can put yes For A, text A for yes, B for no, or C for not applicable. If you do want to be contacted for further assistance, if you already know you have some questions, or you may, as you try to understand this objective better, even other requirements of the program, make sure if you put yes that you put in the chat box your information so we know that we can reach out to you to see what further questions you have. I will be answering questions at the end of this presentation, so if you already have some of those questions you want answered, please feel free to go ahead and put those questions in the chat box, and I will answer those at the end of the presentation, which we're getting pretty close to the end. So please go ahead and respond, A, B, or C. Give you a few seconds, or just save you some time so you don't have to go finding the email addresses at the end of this slide. We'll reach out to you. But again, if you do put A, please make sure to list your contact information in the chat box, which you can send directly to Health Current, or and we'll make sure to gather that information and reach out to you. Give you a few more seconds to respond to that. Okay, again, if you decide after this presentation you have some questions and you not put yes, so again, we're going to provide you contact information at the end of this slide. Next slide. So we're going to be discussing the audit findings and just what happens during an audit. All providers that receive a Medicaid PI incentive payment could potentially be selected by Access for post-payment audit. If selected, Access post-payment analysts will conduct a thorough review of the documentation attached to the ePIP attestation and ePIP to determine if it meets the program requirements. Additional documentation may be requested to validate the accuracy of the opt-out patient log. Access may have follow-up questions or make additional documentation requests during that audit. Next slide. There's some common audit findings. You want to point these out just to make sure you're not making these mistakes during attestation. That way will save time from the Access having to reach back out to you and you have to go resubmit documents. A common audit finding is that the CERT dashboard does not show the PI reporting period or the EP name. Those two things are required on that CERT dashboard that is submitted. So make sure before you submit it, you can find the PI reporting period and the EP name. The second common audit finding is failure to maintain documentation and the practice no longer has access to the CERT. So make sure any document that you're submitting, make sure it's correct and make sure that you're saving it and you're not just getting rid of it, especially if you're transferring from you're switching to different CERTs. Make sure you're maintaining all the necessary documentation. Another common audit finding is supporting documentation does not have the appropriate date. Again, that's like the wrong PI reporting period. So say you attested to the PI reporting period of October through December, but then you submitted the CERT dashboard for a different reporting period for January through March. Just make sure what you're attesting to supports the documentation that you submit. Another common audit finding is including data for the entire practice in the reported CERT report rather than data for the individual EP. So make sure that CERT report is only pulling the numerator, denominator, and percentages for that individual EP, not the numbers for the entire practice. Another one is that not uploading the CERT dashboard during attestation. Go ahead and upload that during prepayment. Otherwise, the Access will be reaching out to you to request it. Next slide. Here are some resources that you can go to, some different links that you can click on to look at the CMS tip sheet, the CMS broadband access exclusion document, the final rule. We did put together an Access patient electronic access frequently asked questions. Just some questions that we thought you might have. We wanted to go ahead and put out there with the answers to those questions. So feel free to check that out, as well as there will be an additional webinar next Thursday covering Objective 5, patient electronic access. But it's going to be an open forum, so we're going to briefly discuss a few things, and then we're going to open up and have y'all ask any questions that are lingering in your mind. Or as you do further research after this webinar, come to the open forum with additional questions, or just come to listen to other people ask certain questions. Again, this webinar and all its resources will be made available to you after the webinar. We are nearing, we have a couple minutes left, so if you have any questions, please feel free to go ahead and put them in the chat box if you have any questions. We'll give you a few minutes to enter those in. I know we only have a couple minutes. Christine, would you mind pulling up the frequently asked questions document just to show them what it looks like?
No, not at all, Priscilla. There we go. Can you see my screen?
Yes, I can. Thank you, Christine. So as you can see, there's 6 pages of various questions that we thought you might have. So if you're not sure what questions or where to start trying to understand this objective, you can go through these questions and just read through them and make sure you're understanding what those answers are. Again, if these questions cause you to have more questions, definitely join us for the webinar next Thursday, where you'll be able to ask additional questions. The webinar will be on August 6th at 12 p.m. Again, if you have any questions, feel free to put them in the chat box, and I'd be happy to help answer those and clarify any concerns or questions that you have. And these questions, they do relate to Measure 1 and Measure 2 for Objective 5. And all those blue links, those blue wording and blue underline, those are links that will take you to different, to the Access website to take you to where that presentation is going to be posted.
Priscilla, you did get a question. Where do we find the link to register for the webinar next week? Please go to healthcurrent.org/events, and you can register via Eventbrite. And I'll include that in the chat as well. So that is healthcurrent.org/events. Click on the registration for next Thursday, August 6th, from 12 to 1.
Thank you, Christine. I do highly recommend to everyone there are multiple webinars that will be conducted throughout until the end of this program. That Access and Health Current have worked together to put together a schedule. So just keep an eye on those events and come to all those. We will be covering different objectives. In August, we will be covering stage 3, just general, for all the requirements of the program. So if you have any questions, or if you want to learn about even more events besides just next Thursday for the open forum, make sure to go there and check out which webinars and what the dates are. Put those in your calendar ahead of time. Okay, I do not see any questions, and we are getting close to the end of the hour. So if you do have any questions or want to reach out to Access or Health Current, Christine, could you put the contact slide on the presentation?
Yes.
So we do. And as you can see, here's the contact information for Access and Health Current. If you have any questions or about future events, about the requirements of the program outside of just Objective 5, please feel free to email or give them a call. Again, that's for Access and Health Current. They both want to assist the providers for any questions or confusion that you may have about the program.
Wonderful. Thank you so much, Priscilla, for walking us through today's patient electronic access presentation. Thank you for all of you who participated in our live polling today. Just a reminder that we will be sending out the slide deck to all registered participants, and a recording will be posted on the Access and Health Current websites. We are at the top of the hour. I do not see any additional questions coming through. Again, if you want to send those privately to either Access, the EHR incentive payments at access.gov, or to Health Current for educational assistance and support, EHR at healthcurrent.org. And you can even reach out via phone, and the numbers are listed on the screen. Thank you again, Priscilla, for your presentation again today. I hope everybody has a wonderful afternoon. Thank you.